everyone. Good afternoon and welcome to our virtual baby shower series. Thundermist providers are here today to offer insight into stress during pregnancy. We have Jennifer Guevara, licensed clinical social worker, Deb Doran, licensed clinical social worker. Thundermist behavioral health providers discuss coping mechanisms for stress related to pregnancy and stress that could come before and after birth. This is a live event, so please type your questions in the comments during the live stream and we'll do our best to answer them. We have an amazing group of organizers who sponsored this baby shower: Neighborhood Health Plan of Rhode Island, United Health Community Plan of Rhode Island, Cup Health Plan, and Landmark Medical Center. Thank you for your generous sponsoring this. We are excited to have one of our baby shower sponsors with us today. Landmark Medical Center can explain how you can enter to win the grand prizes.
Hi, I just want to introduce myself. My name is Kim McCormick. I am the LDRP director here at Landmark Medical Center. And if you're watching this, it means you're pregnant. So I want to say congratulations in advance because you're going to have a wonderful, healthy, beautiful addition to your family. And I want to thank you for allowing us to be part of the process. It's much appreciated. So I'm here to explain how to enter this contest. Okay, so we're super excited to announce the information about the raffle prizes, and I'm going to tell you how to enter. Just so you know, the grand prize raffle items include a new crib, a car seat stroller combo, and a baby monitor, all of which we need when we have a baby. So how we're going to enter this? You're going to watch each session live or recorded, and you will be able to get the link from watching the sessions that will allow you to enter for the grand prize raffle. We will share the link in the comment section of each session. Viewers have until Sunday, July 26th to enter to win, and winners will be announced Monday, July 27th on Facebook. As a sponsor of Thundermist, Landmark has a lot of helpful resources for pregnant people and children. If you have any questions for us, please leave them in the comment section and enjoy the event. Congratulations.
Hi, I'm Jennifer Guevara, behavioral health clinician at Thundermist of Woonsocket.
And I'm Deb Doran, behavioral health clinician in South County.
So these are some of the frequently asked questions that we are going to answer to begin. So Jennifer, I'll start with you. So pregnancy is filled with unknowns. How do we manage stress associated with the pandemic?
Well, I just want to say, first of all, that, during this time, we're all experiencing a collective trauma that is causing us all a lot of stress. And I can't imagine being pregnant and having that stress as well. So I definitely want to point that out. And of course, we can't get rid of, COVID-19 and this pandemic, but we can find ways to manage it better. So some of the recommendations would be to, first of all, try to keep a routine as much as possible. Make sure that you always take a shower, that you're eating. Very important to limit our time on social media and watching the news. If we're watching it all day long and that's all we're seeing, it's really hard for us to kind of separate ourselves from that. So really taking 30 minutes a day is the recommendation. And talking to our support system, our friends, our family, whoever we can trust. Also practicing mindfulness or relaxation exercises can help. Making sure that we're resting as much as possible, exercising. There's a lot of, free things on YouTube and different apps as well that is recommended also for women. And, focusing on your baby and trying to be healthy for your baby and trying to enjoy being pregnant as much as possible, and trying not to focus on, what's going on, but on the baby and their health and your health as well. But if you are, continuing to feel extremely worried that it's impacting your sleep or your appetite, or your mood, and you're noticing that, or people around you are noticing that, it's important for you to talk to your medical provider, so that they can refer you to talk to a behavioral health clinician or maybe a psychiatrist, because some people might need that. This could be a triggering time for people, especially people with trauma histories. So it's important to ask for help. I don't know if Deb has anything else that she would like to add.
I think the self-care piece is huge, right? Especially now with COVID, because we're all kind of locked in the house, and that makes it even harder. But getting out, getting some exercise, taking care of ourselves. I mean, it's important for all of us, but I think that can be, when you're stuck home and pregnant, that can be your little period of really working on taking care of yourself. But I think everything else you said is pretty spot on.
Okay, thanks. So Deb, with all the stress and fears around us, how do we handle like appointments or baby's first checkup if baby getting sick?
Yeah, and I think that piggybacks a little bit on what Jennifer was saying. I think there's a host of things. First of all, taking care of yourself, recognizing that the more we take care of ourselves, the more we're taking care of our baby, right? Whether we're pregnant or postpartum. So I think that's pretty essential. And I think, the support system is huge, to have other moms that can say, this is normal, your stress, your anxiety, your worry. And again, as Jen said, limiting our access to all the really scary information that's out there. You take too much of it in and you assume it's all actual, and it's not, right? The reality is that most of us are going to be just fine, Yeah. Any thoughts you have, Jen?
Well, I think we're focusing a little bit on the social media and the news and everything. So if that is your thing and that's how you like to spend time, there's also a lot of positive apps and people, influencers that you can follow that can be a more positive influence on yourself rather than the scarier things. So and there's a lot of information too about taking care of the baby, about mental health. So kind of, still using those apps, but, figuring out who it is that you're following on them.
Yeah, and I think you're right. I think to make sure that, you need information, right? We all need information, but make sure that information is coming from a really reliable and valid source. So it's coming through Baby Center. It's coming through somewhere where it's been really filtered and is accurate.
Mm-hmm.
Yeah. Jennifer, can stress harm the baby?
So there's been a lot of research on this, and from a medical perspective, I'm a medical provider, I'm a mental health provider, but there's a lot of research that shows that high levels of stress that can continue for a long time may cause health problems like high blood pressure and heart disease. So during pregnancy, stress can increase the chances of having a premature baby or low birth weight. But from a mental health perspective, it can impact brain development, sleep, and behavioral disorders. So there is a lot of research on this. So it's important to decrease our own stress when we're pregnant so that it's not impacting the baby.
And I think that there's a spectrum around that. Pregnancy is a stressful time. It's wonderful, but we're all going to experience some stress during pregnancy. Mm-hmm. We're really talking about serious, prolonged stress that's going to have those impacts. Don't you think, Jen? It's not the normal kind of pregnancy-related work.
So, yes, exactly. And I mean, we're all going to experience stress. It's about how we manage it too. And also like that toxic stress that you're talking about. So like if there's, significant financial issues or if we're experiencing physical abuse or anything like that, is when it would be considered more of a toxic stress and when we should really seek out help.
And sometimes I think for a lot of those kind of situations, just being able to talk to someone can really alleviate a lot of that, knowing that you're not alone in this, knowing that other moms are experiencing the worries, because again, we're having pregnancies and newborns in a very different time right now.
Mm-hmm.
So that leads to my next question, Deb. So how do you know when to contact the doctor about something sad?
Yeah, I mean, I think there's kind of some concrete answers, and that is that, if your sleep and appetite and energy are feeling significantly off, obviously, if you're having thoughts of harming yourself or harming your baby, but backing up, I would say, hormones are a big part of this, right? So anyone who's had a baby knows that there's definitely fluctuations in mood. But if your down mood or your anxiety is really beginning to impact your ability to do your daily activities and you're not feeling any joy anymore, day in, day out, I would say within even a week or two, I would say reach out to your provider, get it assessed. Do you agree, Jen? Do you think there's
Yes, yes, and a lot of providers too are doing maybe like a PHQ-9 or some type of um, survey when you go to the office, and it's important to be honest. It might you might be embarrassed because mental health is not something that we talk about a lot, but we're asking those questions because we care and because there's resources that can help you and the baby. So it's important to be honest about that. And I'm sure, once when you go to have the baby, they'll probably ask you those questions as well. So, just reach out, and we're here to help you and support you.
and I would say err on the side of caution. If you're like, gosh, I don't know if this is normal, let somebody help you sort that out. What is normal down mood versus something that we're clinically concerned about.
Mm-hmm.
Jennifer, how can Thundermist help a pregnant patient with a substance use disorder?
Yes. So, kind of going back to what we've been saying, we're here to help. So the most important thing is being honest with your provider. They might ask questions about your substance use, and it's important for you to be honest about that because it can harm the baby. And so we have some resources. So we do have behavioral health clinicians on site that can see you for therapy. We also have medication assisted treatment as well for those struggling with substance use. But if you need some more intensive services, so intensive services would mean, referring you somewhere else, like maybe women and infants, because some people might be relapsing. So if we're noticing that, you're going to your appointments, but you're still struggling with relapsing, then we would refer to more intensive care.
So Deb, are there specific resources that could be helpful to expectant or new parents who are feeling overwhelmed?
So certainly I'll tout Thundermist and say we have a lot of resources available as a starting point, right? We have our behavioral health clinicians, we have our psychiatric nurses, your family medicine doc. But beyond that, Women and Infants has some wonderful programs in place. They have a lot of resources available, and I actually wrote these down, so hold on for this one here. The other suggestion is Project Link, which is another great program for families, and the Rhode Island Family Visiting Program, which Jen told me about. I didn't know about this one, so this is tell me about it, Jen. I don't know a lot about this one.
Yes, so you can call or text the number.
I wrote it down.
Yeah, and basically they come to your home. It's for pregnant or women with kids, I think up to 3, maybe 5 years old, and they just answer any questions that you have about pregnancy. They'll probably ask you also about your mental health status, and it's just having someone to support you and tell you like what you're feeling is normal about pregnancy, answer those questions, help prepare you for you to bring this little baby home. So that's kind of the purpose of it.
Do we think they're still doing home visiting with COVID? Do we know this? I should have.
Maybe not, but they probably check in, virtually is what most people are doing.
Yeah, yeah. And again, I also think Women and Infants historically has a lot available to people as well. A lot of, nursing classes and caring for your baby classes and a lot of that stuff. And prenatal yoga is available in a host of resources out there. A lot of places offer prenatal yoga. Open Circle is one of the places that does that. And then an app called Ovia, which will give you updates on sort of where you are in that pregnancy process, how your baby's growing, that kind of stuff.
Mm-hmm.
Anything else that you can think of, Jen, resource-wise?
Well, I would just say, wherever you're going to plan to have your baby, they should have also prenatal classes for how to take care of the baby, breastfeeding classes. So, I mean, I'm not sure how they're doing it right now. I'm sure they're doing it probably virtually or, taking precautions. So those are, I think, really important as well. And there's a lot of resources too online through the Ovia app, not only development, so they don't not only answer your questions about the development of the baby, but also they have different groups that you can ask questions, so that you can feel a little bit more connected to other moms that might be going through what you're going through. So those are some of the resources, yes.
And I think utilizing other moms is important too. Women have this ability to say, I've been there. I've been in your shoes. I know what this is like. I remember feeling that too. And normalizing those feelings can help a lot.
Mm-hmm.
Great. That all sounds great and very helpful. So we'd like to take some viewer questions now. If any of you have questions, you can just enter them right in the comment section, and I will read them to our providers. We'll give you a minute to do that. So one of the moms is asking if we know if they will still take newborn pictures at conference.
I don't know the answer to that.
I don't know either. I'm not sure, but I would recommend for them to call wherever they're going to have the baby and ask them. Most hospitals have like a number, like a 1-800 type of number that you could probably connect with.
And I wouldn't be surprised if your Thundermist provider knows too, your doc who is going through your pregnancy with you. I wouldn't be surprised if they would have some understanding of what's been going on in delivery and postpartum.
Mm-hmm.
Any other questions from our viewers? Don't be shy.
I see another question on there. You see that, Jill?
Our hospitals different now. What should moms expect?
Do patients have to come on site for behavioral health services right now is one of the questions. And the answer is you do not have to. We are doing telehealth, and if people need to be seen on site, we're accommodating that as well.
So we're doing phone and video.
Video, yeah.
Mm-hmm.
Perfect. So that mom just said thank you about the picture question. You're welcome. So does anybody know how the hospital experience may be different now and what moms can expect? I had a friend that just had a baby, and she did say that you could only have one person in the delivery room.
Yeah.
Yeah, that's as much information as I know for sure. But I would say I would expect it to look a lot different, like more precautions and everything. So I'm sure that experience is hard, especially wanting to have family members see the baby. Like that's always something that everybody's waiting for, right? To see the baby the next day. So I would say that sometimes as a relatively new mom, I have a 17-month-old, sometimes that it's kind of overwhelming to have a lot of people. So try to kind of focus on the baby and taking care of yourself, and whoever is accompanying you to try to support you as much as possible. And if you're hungry, say that you're hungry. Make sure that you're breastfeeding. If you are breastfeeding, that you're eating. Sorry, that's what I meant to say. So those are some of my recommendations.
And I think we didn't mention this at all, but I think it's important, which is also the lactation support that's available for new moms who choose to nurse. That that can be another worry, and there's a lot of support available for that as well. And in the hospital they can talk you through that, and they used to, I'm assuming, still come out to your home and provide that kind of support post when you leave the hospital as well. It's an important piece not to forget about that support system.
Okay, so we just found out that Kim, one of our sponsors from Landmark Medical Center, has the answer to this question. We're going to bring her back up on the screen. Hi, Kim.
Hello. Every hospital has a little variation in what they're allowing through this COVID process. But in general, from what I know, every hospital is allowing one person to be with that mother in labor. And that is most of the time the only person they're going to allow to even come in and out of the hospital to see that mom. So once you've picked your coach, that is most likely going to be your only visitor allowed. Because they want mom to have support, but they also don't want to put her at risk. So pick your coaches wisely.
So I think that answers one of the other questions on there too, which was about dads being allowed in the room. Yeah.
Mm-hmm. I mean, there are some, if you had a mom that came in and she was COVID positive, they would still allow somebody to be with her, but what occurs following delivery could be a little different in regards to mom and baby and keeping them together. Again, it's always about the safety of the mom and the safety of the baby. So if you have deeper questions than that, they definitely need to talk to their provider regarding where they're going to deliver.
Do we have any more questions from our viewers? I'll give you a second. So I think that might be it. So we want to thank everyone. We hope you enjoyed getting to know our providers and our sponsor, and that we were able to answer your questions. Before
She left us.
What happened?
I don't know.
She sounds like she's coming back.
No. All right, so we're going to assume that we've lost her, unfortunately. And so we want to thank Neighborhood Health Plan of Rhode Island, United Healthcare, Community Plan of Rhode Island, Tufts Healthcare, Landmark for generously sponsoring this series. And we want to remind you as well that if you need prenatal or primary care, postpartum care, Thundermist offers services to people of all ages. We don't turn anyone away, regardless of insurance, regardless of inability to pay. And you can call, should I say out the number here? 401-767-4100, and we will happily schedule you. And am I wrapping up? Okay.
Thank you.
Thank you.
Thank you very much. Congratulations.
Bye.